Town of Littleton Board of Health meeting. It's 7 o'clock and we'll get started. We had some technical difficulties with our agenda over the past few days. So things are going to be a little bit fluid tonight, but I wanted to start off the meeting by just addressing the elephant in the room. We had some correspondence come in and not the first time regarding some questionable and unprofessional conduct of one of our board members, and that those concerns have really been taken to heart. And I wanted to give board member Fratelloni a chance to publicly apologize and explain sort of what's been going on so we can quell some of these concerns. And then if the board members would like to discuss further, we can do so during board member comments towards the end of the meeting. So Mr. Fratelloni, if you would.
Okay. I have a brother, 92 years old. On November 20, he passed away. I left the house 4 o'clock. I told him goodbye and I see you the next day. As I was approaching Littleton, I was halfway. My sister called me up and my brother, 91, was crying. My sister was crying. I said, what happened? She said, your brother passed away. So I had to return because I had to make arrangement. They were not able to do it. They say, oh, leave him there for another day. We miss him. You can't leave a person that is dead in the house. So anyway, I made arrangement and then I had to call the police. The police came with the fire department. When they came, I was there because took me another half hour to go back. And in the meantime, when I was going back, it was an accident. 3 cars and 2 people died. I said to myself, my papa was right. It comes in 3. So anyway, I got to my sister's house. Oh, and I thought maybe my brother probably fainted or something. I touched him and I gave him a hug, cold as ice. I said, I guess he's dead now. He certainly is. So the police came, the fire department came, they checked him out. They says, a heart attack. They had a computer and everything. I thought that one of the fire department, I thought he was a doctor. Not to worry, he didn't have a heart attack. He's okay. He just died, 92. It's a blessing. He didn't suffer. He wasn't sick. He just happened to go. I guess it wasn't meant for me to see him the next day. Nevertheless, I went through the funeral for the past 3 or 4 weeks. I had a bad time. I didn't even have a chance to realize that my brother, that he took care of me when I was a kid. I used to be a Boy Scout, and he used to take us maybe sometime we had 10, sometime we had 18, all depends. Every year was different. But nevertheless, he took care of all the young kids. He was a good person. Not only I lost a brother, I lost a friend. So I did everything. I made arrangement for the funeral. Then I had to go to his apartment because he lost his wife 6 years ago. And the lady only gave me a month and a half to get everything out of there, even though I paid for 2 months. She said, no, we got to get the apartment clean. I says, okay. So I got in touch with a couple company. They said, we can't do nothing for another 2 or 3 weeks. So I was working every day. I had a different meeting and everything. I was working. I get up early in the morning and go to Somerville. In the meantime, somebody told me, says, call this company. So I call a company and they will say, I'll send one individual and he's going to get the estimate, how much it's going to cost for you to empty their apartment. So he came and I had to be there. And he says, okay, this is what's going to cost you, $3,300 to empty everything. So he says, are you there tomorrow? I says, yeah, I'll be there tomorrow. And so I went there, and because I had the key, I couldn't let anybody in unless I was there. And one day, They empty 1, 2 trucks. The next day I went back, another truck. It was 2 trucks full. And then I had to do some stuff on my own because those 2 trucks was full. So I didn't have an intention and tell them to come back for something small stuff that I could do myself. So I did everything, and I had different meeting and everything. And I guess in the meeting, the first week that we had a meeting, I couldn't hold it no longer. I didn't have no tears come out of my eyes because I had to take care of everything. But I guess when you think about a brother that you love him and he took care of yourself, it was a friend. Sooner or later, it's going to get you. So anyway, that happened. And I couldn't tell anybody. And then another week, we had the meeting, and I was very tired. And I said, I don't know what happened. I tried to stay with the meeting, but I guess I have to apologize because I think I was very tired. Because working all day and then get up early in the morning and do different activity. I feed the kids. I do a lot to help other people. So that is my story. If anybody has a heart, let them decide whatever they want to. But the question is, I was elected by the people in Littleton because they trusted me. When I run again, if they don't want me, they're not going to vote for me. But I'm staying. And I will promise now everything is done. I don't have anything to do. So I leave it up to you guys. But I'm not going anywhere. Okay, Mr. Chairman, you got my story.
Thanks, Gino, for the explanation. Sorry to hear about your brother. And
Thank you. Thank you.
wish you the best.
I hope nobody lose their family members because it's very hard to digest. It's not something like you can say a tear and then forget about it. No, it stays with you for a long time.
So if we'd like to discuss this further, we can do so in the member comments section of the meeting tonight, and figure out if there's, if we want to establish some sort of criteria for things on this board and member conduct and things like that. We can get to that later in the meeting. We can. Sam Alvarez is not going to be joining us. That was a typo on the agenda. We do have 7:10, which is just in 2 minutes, to approve the minutes of. And Janet, I thought we were approving January 13th. We're just going to approve December 15th.
The agenda says January 13th.
Okay. Did everybody get a chance to read those as well? Okay.
I did too. So
I know, Mike, you had a comment and a correction on a portion of it.
Yeah, I just want to make sure everybody, not that it's breathless prose, but I just want to make sure everyone saw it, that we're all on the same page of what we're approving or not. That's all.
I did.
Okay, thank you. I make a motion that we approve the minutes for January 15.
13.
Sorry, January 13.
Okay, we have a motion and a second. We'll do a roll call vote. Gino Fratelloni.
yes.
Dan Kane.
Dan Kane, yes.
Matt Wason.
Matt Wason, yes.
And Mike Zeldin.
Mike Zeldin, yes.
And Kevin Baker votes yes. Next on our agenda, it's a 7:15, but Jim, I think we can get started a little bit early if that's all right with you on the COVID update.
Sure. So again, I provided Mike some numbers this morning based on the 2-week rolling. I guess probably the bit of good news is that most of the communities were down, and some of them down pretty significantly. Cases, in that 2-week rolling period of time. Well, the official numbers will come out tomorrow, but looks like Littleton's numbers dropped pretty significantly along with some of the other larger communities that are in the district. One of the things I think is really important is all of the isolation and quarantine guidance that's out there. You almost have to sit in front of a computer screen with all of the documentation because you have not only the stuff for the general public, but you have DESE's guidance and early education and care, EEC, as guidance that kind of mixes both of those. And that guidance has been updated from last week. I'm not very good at all this Zoom meeting stuff, but one of the things I did want to bring up, because I think it's important, is the state webpage for isolation and quarantine. So I think I have it up. I just don't know how to
Share.
Yeah, so what I'd like to do is go to that page, and I don't have it up, so I'm gonna have to bring it up.
Take your time.
Because I think, oh, there it is there. So, so there's a web page. I'm just not sure how to share it with y'all.
Down in the center section on the bottom of your Zoom screen there should be a green button. It says screen share.
Okay. Yes. Oh,
And if you click that, it should ask you, is this the right screen to share? And then just click on that screen. And it should pop. Yep, there it is. We can see
okay.
it. Yep.
So, and again, one of the things I like about CDC is they actually put a date on their web pages to let you know when they have updated them. Department of Public Health just doesn't seem to do that. So this would be the page that we would direct citizens to for information on isolation and quarantine. As we've mentioned before, the state has changed the way the contact tracing process is. We have 5 or 6 or 7, depending on the day, contact tracers who call the new cases that we get. In addition, we also send out an automated text and a voice message to people to let them know. And this would be the site that we're sending people to for information if we can't reach them. One of the things I want to do, and one of the things that they've changed since the last time I've looked at this, is both for if you test positive, so those people who need to isolate, they've changed a couple of things that I think are important. One is this able to mask. It used to be just included, like it would say here, wear a mask around others for 10 days. But they've made a point to change this chart to include able to mask. And they have the asterisk, so you can actually get down to the bottom and see what it says. And so that's a significant change from the last time these guidance were up. And they go through what you need to do. The other thing that they've changed, we all talk about being boosted. What they've done now is they've kind of changed what it means to be the way we used to call fully vaccinated to this new term that's called up to date. And again, there's an asterisk there. And if you get down to the bottom of the page, it essentially means up to date, essentially is, I guess with other vaccinations, I'm told by our public health nurses, to be up to date means to have all of the shots that you would normally have in the series of shots. So I guess this is the more mainstream language for vaccinations. So this is what up to date means. Essentially means you've had the 2 doses of Pfizer or Moderna or 1 J&J and have been boosted within the past 5 months. So that's one, or been boosted. So again, just some changes to that chart. And I think it's important that people go and take a look at those changes because it makes a difference. Again, your ability to mask. And we were running into this with daycares in a couple of different ways. In a daycare, you know, the old guidance would talk about, even if somebody was now up to date with their vaccination, if they tested positive, they would need to be able to stay away from people. And then after 5 days, wear a mask. And the idea was that you would be able to wear a mask in distance. Well, daycare operators, particularly if it's like a home daycare, can't really distance from the kids that they're in care of. And a lot of times those kids aren't A, vaccinated, B, they're under 5 years old, so they can't get vaccinated. So we have lots of conversations around with daycare providers about how long that they need to stay open or stay closed primarily. So I think, again, it's been added to the chart, so kind of emphasizing DPH's, the importance that they're putting on that. And the asterisks about ability to wear a mask, is down the bottom there. And so, again, age, medical, or behavioral conditions. So to me, I think it's really important that people take note of this website. This is the site that if you call us and want to have a conversation about what you need to do for COVID, this is the chart we're going to bring up. And then we'll probably bring up 2 others, depending on whether you have kids in daycare or whether you have kids in the public school system. So I don't know if there's any questions on it. I just, again, to me, the chart changed significantly. The information changed significantly, and I just want people to be aware of the fact that it had.
Janet, I'm wondering, can we get a link to this current guidance up on our site?
Yes.
Thanks. Does anyone from the board have any questions, comments, concerns?
I know Jim said that the preliminary numbers, obviously our official state numbers for the previous 2 weeks will come out tomorrow. I hadn't seen, can you give us an unofficial, recognizing and acknowledging that there are unofficial numbers of where we are for the last week?
Yeah, they're usually within 2 or 3. So, the last 2-week rolling period for last week, Littleton's numbers were 320 cases in that rolling 2-week. If all things kind of hold, it'd be 219 for this when they get released tomorrow. So again, it looks like probably about a 30% drop in cases. So,
Oh, that's great. Thank you.
Yep.
Jim, do you have anything else on the COVID update?
No, I think you have a section of your meeting that's talking about masks. I'm sure we'll probably have a larger conversation about that. So I can certainly convey experiences and complaints during that period of time.
Sure. Is Katrina with us? Yep. Hi.
Hi.
How are you?
Okay, how are you?
Doing all right.
Jim, if I may ask a question for the website that Jim just shared. So the booster guidance for the state is for all ages who are eligible for boosters, and that same time period has passed, correct? So 12-year-olds who just became eligible would be, that would fall under that?
That's right. So I guess that's why DPH has moved to that up-to-date definition for vaccination. Because obviously 5 to 11-year-olds can't get a booster. So
But it doesn't keep them out of school because of DESI's policies.
That's right. So this is
Okay.
where this gets,
It gets a little complicated, I know. I just wanted to make sure there wasn't a change that impacts access to school. Okay, thank you.
Yep.
All right, now I'll share my screen. Thank you for letting me ask that question. All right, and my notes. Everything got moved when I got uploaded to the panel. I'm sorry. All right, we'll jump right in. So this is that DPH trend page. And we're just going to go through quickly tonight. So this is the overview. So the 4 main metrics. Cases are in a decline. Jim just said our local cases are about a 30% lower, states about 30% lower or so. So that's a consistent measurement. The current level is around 6,600 cases per day, and that is still higher than we were last winter. So just for, we've had a big drop, but we have a way to go. Test positivity has also declined in the last week substantially. It's about half of what it was. It's 10.4% at this point, which is another good sign. Hospitalizations appear to be cresting. Just about cresting. We're now around 2,900 hospitalizations a day. It's the first time that little peak started to appear. So that's hopefully that will continue. But deaths are increasing at this point and have come up to 60 per day.
Jeez.
So that is our lagging metric too. So hospitalizations usually are 2 to 3 weeks behind when cases start to go down. So in the next 2 weeks or so, that should start going down, and then deaths will start going down. So this is the state report on cases, the case rate by 100,000 for the last 6 weeks by age group. Again, the rates for all age groups are higher than at any other point in the pandemic. I am just showing you the last 6 weeks here. And this was from the January 20th report. This will be updated again tomorrow. Cases among age groups aged 15 and older seem to kind of slow over the last 2 weeks. They weren't accelerating at the same pace as they had been, but rates continue to rise for children 0 to 14 years old. So this is the hospitalization data. And at this point, the 7-day average seems to be around that 2,900 that I mentioned on the prior slide. And looking at, it seems to be cresting. We'll keep an eye on this over the next week. And looking at the ICU and intubation data, it seems to also be cresting. So it's all kind of doing the same thing, which is a good sign. And vaccination status, health history, and age continue to be the largest predictors of who end up hospitalized or needing high-level hospital care. I know a lot of people look at the number of cases that total and then the number of fully vaccinated cases and then get upset because it looks like it's 50% of cases are fully vaccinated and 50% are unvaccinated that end up in the hospital. And that's kind of demoralizing in some ways, but that doesn't take into account the denominators of the number of people in our state who are fully vaccinated or unvaccinated. So I took this is the data from the 24th of January and just said on this day, this is what the rates were. So there were 1,333 fully vaccinated hospitalized cases per 5.1 million fully vaccinated residents. And that fully vaccinated is that 2-dose or 1 J&J level. It doesn't consider boosters. And the rate was 26 per 100,000. When you do the same thing for the 1,355 unvaccinated hospitalized patients per the 1.7 unvaccinated Massachusetts residents, the rate is 78 per 100,000. So essentially on January 24th, the rates were 3 times lower for fully vaccinated individuals compared to unvaccinated individuals. So it's really important, or 3 times higher for unvaccinated individuals compared to fully vaccinated individuals. So the vaccines are working. They're definitely keeping people out of the hospital. So the state has added some information about hospitalizations. They're now distinguishing hospitalizations as incidental COVID, which is there for other reasons, and COVID, they happen to be COVID positive, versus a primary COVID hospitalization, which the reason they're in the hospital is COVID. This distinction is defined based on receipt of dexamethasone, which is a steroid drug used to reduce lung inflammation linked to COVID infection. It's been used since early in the pandemic, actually. This definition will actually undercount patients with moderate to severe COVID that require hospitalization because it will miss those who enter the hospital for reasons related to their COVID infection that are not lung related. So what I'm trying to say there is that things such as we know that happen with COVID infections, such as blood clots, heart conditions, people with lingering COVID effects that they just finally end up in the hospital, but they don't need dexamethasone, they're not going to be counted. So we know this is an undercount of primary COVID. So last week was the first time the DPH shared this data, and consistently this week is about the same. About half of the hospitalizations were for primary COVID and half were for incidental COVID. And just to keep in mind that any patient who has COVID-19 when they're hospitalized needs, the staff still has to take extra precautions. They have to be isolated. They have to be gowned up. There are lots of things that have to happen that require extra care for those patients and can keep patients in the hospital longer for having to watch for other things. So no matter why they're in the hospital, we still have some issues with capacity, which I'll show next. But I do think it's really important to keep in mind that as we keep gaining immunity with vaccinations, with prior infection, with a less severe variant, we're seeing less and less high needs care in the hospital for each surge, which is a good sign too. So there's good news and bad news. And the other thing to think about with incidental COVID is the higher the rates in the community, the more likely you are to be positive when you enter the hospital. So hopefully as rates go down, those incidental COVIDs there won't be as many people in the hospital, and then also the proportion will change. But the big thing here we're still struggling with is no matter why you're in the hospital, the hospitals are still having capacity issues. Today's report says 93% of medical surgical beds are occupied, 85% of ICU beds are occupied. We still are delayed or canceled elective surgeries. The National Guard are still assisting our hospital staff, and there are still some regions of Mass, which includes our own, there's little to no capacity left in the hospitals. So, and these hospitalizations are a lagging indicator. So we're starting to see improvement in cases over the last week. We're going to expect 2 to maybe 3 weeks before these hospital numbers really start to have that cushion back, because we don't have as many cases hitting the hospitals. So it's going to take a few more weeks to work through. So we do still need to take care and do what we can to control case spread so that we're not continuing to add pressure on our hospital capacity, but in other essential systems, schools, our essential workers of all types. So we're still in a dicey situation, but improving. Okay, so per the January 20th DPH report, as Jim reported, there's 320 cases between January 2nd to 15th. And then the sneak peek that should come out tomorrow was about 219 cases for the period of January 9th to 22nd, which is a good improvement. We hope that will continue. This data that I'm showing is the 2 metrics that we get for the municipality report. And these are from last Thursday's report. So this is based off that 320 cases for Littleton. Littleton's average daily incidence rate had increased to last week to 235 per 100,000, but that was a much slower acceleration over the week prior to that, and the actually prior 3 weeks. So it was nice to see that slowing, and we expect this to go down tomorrow. Littleton had nearly 2,000 tests conducted, which was actually a higher number of tests for the same 2-week period. The test positivity was 17.7, which was actually about the same, slightly lower than the prior week. So that was a good sign of things slowing down, cresting, hopefully coming back down. Remember that test positivity is not a measure of number of people who are positive, but the number of positive tests over total number of tests conducted. And it gives us an idea of whether our rates are underestimated, and we are above 10%. That's kind of the threshold that has been used this whole time to say, we know we are missing cases in our town case counts, because we are at 17%. So this is school data. The nice thing about the school data is it is trending like the state is, it is trending like our town is. So things are very consistent. The Littleton school cases, these are through as of today. So the first week of January, which was this purple line, was 83 cases that week, which is an average of 12 a day. The next week, which is the second week of January, was 95, an average of 14 a day. And then since then, last week was 66 cases, an average of 9 cases reported a day. And this week so far, we have 26 cases, an average of, with 2 days to go in the reporting period. So that's about an average of 5 cases per day in the district, and lower than last week. So we are looking good for, barring any unforeseen clusters in our school, for this number this week to be lower than last week and continuing that downward trend. So keep your fingers crossed. So getting on to vaccinations, the proportion of fully vaccinated residents is now 85.8%. That was not this small increase over the prior week, with another 10% partially vaccinated and 4% have not yet started vaccinations. Some of those are eligible individuals. Some of them are 0 to 4-year-olds who are not eligible yet. 5 to 11-year-olds are doing really well. We're now at 71% fully vaccinated for that age group, given that they just became eligible at the beginning of November. This is that's a huge jump. We're doing really good, and another 19% of them have started their vaccination. So that's amazing to see. So it looks like our elementary schools are catching up to our middle school and high school in terms of number of people who are fully vaccinated. Sorry, not sure why I have an alarm on. Okay, so the next part is boosters. The state started giving us booster information. I've taken these and looked at the number of eligible people. So I estimated that based on number of people who were fully vaccinated 5 months ago, and then done the math to see who's eligible. So approximately 84% of Littleton's fully vaccinated population is eligible. Of those 84% in town, which is around 8,000, 72% have already been boosted. So we've done a lot of work on boosters. There is still more to go. We have about 2,000 individuals in town who are eligible for boosters, but have not yet been boosted. And the majority of them are age 30 and older who would benefit from boosting. So some more work to do to get messages out about boosters. But the town continues to bring clinics to town, and also Neshoba Associated Board of Health has clinics. So there are appointments available for people who want them. I'm going to show a little bit of data from outside of Massachusetts right now. I know we've all heard of many vaccinated individuals who have had a COVID infection over the last couple of weeks. And I know a lot of people are like, why bother vaccinating or why bother boosting? Because everyone seems to have COVID no matter what. But, and that is giving people the feeling that these vaccines are not effective. And that's just not true. These vaccines have been working to reduce the number of infections and to prevent hospitalizations and death, even with Omicron. So these graphs are from NYC Health. They have data through January 9th. They did not update their data today, so I could not pull more recent data, but we'll keep an eye on it. These curves show that the unvaccinated people, those purple lines, are far more likely to test positive for COVID than the unvaccinated, far more likely to test positive than vaccinated individuals. The same for hospitalizations, much higher rate of hospitalizations compared to vaccinated individuals, and same for death. So these vaccines are working incredibly well for what they were designed for, which is preventing severe disease and death, but also working very well to reduce the number of infections. And if you're not infected, you can't spread to others. And if you're not infected, you can't get long COVID. So it's really like, this is working. We have to just keep vaccinating, keep up to date on our vaccinations. And if you actually look closely at these, the curve of the lines, the vaccinated line actually started to curve down a whole week earlier. And at this point in time, maybe unvaccinated were starting to crest, but we don't know. They were still going up at that point. So we will see what happens over the next week. But the curve for vaccinated individuals started to decrease before unvaccinated individuals. So this data comes from COVIDNet, which is a population-based surveillance system in the US that collects COVID-associated hospitalizations for children and adults in 14 states. The CDC has this data, and HHS, I can't remember which one actually. These graphs show that the rate of COVID-19 hospitalizations among people who are fully vaccinated with or without a third booster dose are those who are unvaccinated by age group. And the absolute risk of hospitalization varies by age group. The younger you are, the lower your risk of hospitalization. The older you are, the higher your risk of hospitalization. So you can see that reflected in the y-axis numbers. But for the week ending December 25th, rates, and Omicron was already starting to be in the US at this point. Rates of COVID-19 hospitalizations were higher for unvaccinated individuals in all of these age groups. Rates for COVID-19 hospitalizations were 11 to 13 times higher for unvaccinated individuals aged 12 to 64 years, depending on those cutoffs. And then the rates for hospitalizations for people aged 65 and older who were unvaccinated were 20 times higher than vaccinated individuals who were age 65 or older. So vaccinations are, again, very key to protecting your health and that of those around you. So vaccines are very protective regardless of the age. And then this is also COVIDNet data, same data source broken down by those who had booster shots and those who did not, for people aged 50 to 64 and 65 and higher. Being fully vaccinated was highly protective. So that's just the 2-dose or the 1 J&J was highly protective against hospitalizations for both of these age groups. Boosters then further reduced the risk of hospitalization. And so this underscores that importance of vaccination in preventing severe COVID outcomes, especially in people aged 50 and older who are most likely to be experiencing severe COVID outcomes. Boosters will then reduce that risk even further. So keeping up to date on your vaccine will help you not be infected and then also therefore can't experience the higher risk outcomes. So vaccinations are working. And then other good vaccine news. There is now post-authorization safety results for Pfizer vaccine for kids aged 5 to 11. This is from the VAERS and the vSafe reports from the period of November 3rd to December 19th. During that time, there was 8.7 million doses administered in the United States. 97% of reported events were non-serious, and most were related to commonly reported vaccine-related effects, things like fever, headache, vomiting, short-term, things we expect once you have a vaccine, or administration issues. The wrong dose was given, things like that. So 28% of the reports actually reported no adverse events at all. So a whole 30, nearly 30% had nothing happen. Serious adverse events were very rare. And myocarditis is rare and a serious event that has been associated with mRNA vaccines and noted for the 12 to 30 age groups, especially for males. And to date, the myocarditis reports for 5 to 11-year-olds appear to be rare. There were 11 verified reports out of 8.7 million doses. So safety assessments are ongoing, but these results provide a lot of confidence in the safety of the Pfizer vaccines for 5 to 11-year-olds who are now eligible for vaccination. And then just a reminder about who is eligible for your vaccines. I'll take a screenshot of this if you want, but again, just going to keep pushing. These vaccines are our best tool, so keep on top of your vaccines as appropriate, and ask your doctor any questions you have about them. And then other news that have come out in the last couple of weeks is the CDC has updated their guidance about types of masks and respirators. Some key considerations is that ideally people should wear the best masks they can. You should wear high filtration masks and respirators, which they no longer have to be reserved for healthcare workers. We don't have a supply issue anymore. You should definitely order directly from approved suppliers rather than using websites that you're not sure about. And those can be found on the CDC's website. Cloth masks offer the least amount of protection. However, could be suitable to wear on top of those blue surgical masks to help tighten the fit and improve the filtration. And those common, blue surgical masks are better than cloth masks as long as they fit without gaps around your face. And so there's a range of masks and fit and filtration benefits depending on which mask you choose. And so while it's recommended that everyone upgrade from cloth or surgical masks to a higher level mask, there still could be access or equity issues in obtaining these masks. So to protect yourself, you should wear the most protective mask you can that fits your face well and that you will wear consistently. And the federal government is in the process of making 400 million, I think, N95 masks available to the public soon, which I believe will be available in local pharmacies, but I haven't yet to hear the details of that program. So hopefully we will have information soon about where people can get free N95 masks. And then the last thing that has come out over the last couple of weeks is every home in the US is now eligible to order 4 free at-home rapid antigen COVID-19 tests from the government. These are the kind of tests that tell you if you are currently infectious. So when these tests are positive, it means that there's enough virus replicating in you that you could pass COVID on to others, and that is an indicator that you should isolate from others to not spread COVID. So you should use these at-home antigen tests if you have symptoms such as fever, sore throat, runny nose, anything related to COVID. or 5 days after you've come in contact, if you've been exposed to someone else who has COVID, to make sure that you are not infected and just don't know it yet. Or another way to use them is to use them before going into a group gathering, especially one that includes people at high risk for severe disease, such as if you're going to visit a grandparent, or if you know you'll be in contact with someone who has significant health risks, or if you want to go to a concert or something, just to protect those around you, or coming out of those large group settings before you go into other things. So there's lots of uses for these tests, and it's nice that we can get 4 tests per address, which isn't enough, but it was a start. And that is all I have tonight.
Thank you. Does anyone from the board have any questions?
I do, Katrina and Jim. Either or. I think, Katrina, you included it. The data we've typically been seeing on boosted individuals is not about eligibility. It's just total booster shots delivered. So it's not equal to up to date. But I think, Katrina, you said you back calculated, tried to get us some
Tried
number.
to get an estimate, yeah.
The state is not going to, are they going to be able to get us up to date numbers?
My guess is they're not going to do that work, which is why I did the work. The numbers are there to do it. You just have to compare prior reports. So I took the one 5 months ago and then compared it to this one.
Well, I was more hoping if they've got the records of doses, then they would know when somebody's last dose is outside the window and should fall in or out of the bucket, right?
They do have that, I believe, in the MIIS database that is there, but they're not tabulating it in a way to just tell us as a town. So I did my best guess to estimate how much work we need to do to bring vaccines and boosters to our town.
Yes, thank you for doing that. That's much more helpful.
Anyone else? I have a couple questions. Jim, of the 219 cases that Littleton currently has, can you get a sense of the percentage of vaccination status on that, or due to the contact tracing change, are you not getting that detail?
Well, I'd have to go back and look through all those records to get your sense of that, because that information would be in those records. So I can try to have that for you the next meeting.
Okay. Yeah, I'm just thinking, I mean, if 85% of Littleton is up to date, that would give us like 186 of those folks vaccinated. And I was just looking at Katrina's number of 26 per 100,000 vaccinated being hospitalized. I think you can infer that that's 0.048 people in Littleton hospitalized that are vaccinated. And if you back out the unvaccinated number, it would be 0.025, all from that 219 number, which would give a total hospitalization rate from that 219 number of 0.073 people going in the hospital. Is that a correct inference to make if you use all those numbers? That's the number of folks in Littleton that go to the hospital when they contract COVID?
I mean,
I wouldn't go there.
Yeah.
I wouldn't. You can't. The only way you can do hospitalizations is basically do the hospitalizations. I mean, it's stated that the hospitals do collect. It just so happens the state is overwhelmed, as Katrina alluded. They're not tracking it the way that we here in Littleton want to do it. If you want to see it done really well, take a look at Boston's website, because Boston's has their own health commission, entire apparatus. They have statisticians. They have armies of people doing this, and they're being guided by very solid numbers. I'm not saying no one else is, but I'm saying that they can actually, they know almost by neighborhood, sometimes block by block, of just how many people are in hospital due to COVID and how many people are in the hospital for something else, and the whole breakdown. They got it. I talk to those guys a lot for just to reinforce that the real world does exist out there.
So I do have to say that in the COVID working group meetings, they're saying they're not running ambulances all the time. So the on the local beat is that It's definitely not like spring of 2020 where they were doing daily multiple ambulance runs. And people who are going to the hospital in general are going in a much better state than they have been at prior points in the pandemic. So even if it's 1-2 people in town, we're in a much better state thanks to our vaccinations in terms of severity of disease.
And Kevin, I think the last time Mike asked me to look at vaccination rates, it was probably, I don't know, it's probably back in the summer. Most of the people who were testing positive were vaccinated. Whether that was 1 or 2, in most cases it was fully vaccinated. So, and you know, when the cases started to occur down Provincetown, there was a little footnote in the MMRW report that stated that, you know, because we have such a highly vaccinated state, we should anticipate that most of the cases we see may come from people who are vaccinated. So.
And we have over 8,000 people in our town fully vaccinated at this point. So most of our cases will be vaccinated.
Okay. Well, thank you. No other comments on this from board members? Gino, you got something? You're muted. You're muted. You got to. Janet, can you unmute him? No.
I can ask him to unmute so he can see the button, but
Oh yeah, try that.
I am.
All right.
There you
Can you
go.
hear me now?
Yeah. We can hear you now. Yep.
All right. I say, it seems like we're doing much better every time she comes in. That's good. I hope this pandemic goes away.
I do too, Gina, but I think it's with us. I just don't want it to be this big anymore.
It might be with us. The question is, I think a lot of people are tired and they like to see gone, because it seems like now they're going to say you get another booster, you got this, you got that, you got to keep quiet, but you got to put a mask. People are getting tired, and they tell me that. I says you got to go with it, unless you're going to get sick. You got to be careful. That's it. That's all you can do.
Getting boosted and getting vaccinated are the best things you can do to protect yourself and just get the most normal we can be.
I did all that stuff. I
Good.
did all that stuff. That's why I'm healthy.
Good.
I might be miserable, but I'm healthy. Oh boy.
All right, so we can move on to our 7:30 public hearing, Board of Health mask mandate, a discussion, any correspondence, public input, and potential votes on public health items regarding continuing the emergency regulation of the Littleton Board of Health, or potential amendments. Yes, go ahead, Mike.
All right. I guess this is the good time, is the right time to do it. I'd like to suggest and recommend to our board that we amend to allow a variance to our mask mandate for the town to the high school building to carry out a flex mask operation to start as soon as possible, with the understanding that vaccinated students and others will have the option of being masked or not. Non-vaccinated individuals will have to wear a mask, except those obviously with medical or other attending issues. And a strong recommendation, not a requirement, a strong recommendation that the masking, the preferred masking would be either the equivalent of KN95 or the better N95. Basically, as Katrina has pointed out, we're the very best mask system that you can put together, so that we have some equity in all of this. Definitely the cloth mask is out. I would not recommend that as being useful in the school setting, but again, we're not going to dictate what mask. We want to do make sure that the students have and everyone else has the opportunity the best they can with it. And that's my suggestion. I'll be happy to, join in the conversation about why we're where's and why we're going in this direction. And the best way I can do it is basically the summary and overview that emerges from Katrina's and frankly Jim's summary of where we are and where we're going. And I just want to say we're now into a new time. This is not 3 weeks ago or a month ago or even 2 months ago. We're in a different place. And this is our first step into the, shall we say, new status.
When you say fully vaccinated, are you referring to the up-to-date language that Jim just pointed out?
I'm looking at up to date with the understanding that there may be students and others who are just entering the process because of delays and whatever have you on the part of the parents or the guardians or whatever is going on in the house or not. I'd like to make sure that part of this to encourage that the entire high school population, unless there's a medical reason for it, get vaccinated or at least start the process if they haven't. This is one of the details we could discuss. My recommendation is basically to make sure that you have the full course, 3 shots, 3 jabs, or unless you're using one of the other vaccines. And the other thing I want to mention here is that whatever we do here, it becomes, as it were, the foundation, not the exact replica that we're going to use for other parts of the school system. And that's one of the reasons that I want to be very careful, but make sure we have a full discussion with participation with the school committee members and members of the public, so that when we go forward, we have to have an understanding. This is the beginning of a new time where we're going to take basically recognition of where Littleton and the surrounding communities really are, that we're not in West Texas or South Texas or Florida or Northern California where they still can't go to school. We're in a very different place. Let's keep moving.
Any comment from board members? Dan, go ahead.
Sorry, I would love to have seen this written down just so we could all see it, because you jumped right in that, and I was not expecting a high school mask waiver regulation. I certainly hadn't seen a request from the schools. The last we heard was holding off on their request until further notice, and I have not seen a further notice yet, at least from an official perspective from the school committee. So certainly I would love to see this actually before we can go slower, so we can actually process all the suggestions.
Can I just make a comment? It's my fault because I've been waiting for data from other places to come in about the vaccine for all age groups. Now that it's basically the town is poised to do this now. And the sooner we do this, the better off we're going to be, regardless of what happens next. That's why we're in this different place. In other words, I think it's up to our board to, as it were, set the necessary parameters, and the school committee, I think, has, shall we say, a better idea of, shall we say, the important details that refer specifically to their population in the high school. So I think this is and we've been through this before, so it's not exactly novel. The only difference is that we now have vaccines that actually work, and we also have masking technologies and knowledge that we didn't have like 3 or 4 weeks ago. We just didn't have this. And now we have them both together in the same room, as it were, and that's why it's not in writing yet. It's fairly, quote, new.
So excuse me, but it sounds like the only addition or adjustment to the previous criteria that we discussed and approved when we approved the waiver for the previous dates is that you're recommending N95s or KN95s.
Correct. We're recommending that you have to have a mask, but basically these are the recommended ones. That's it.
And Dan, I believe, just give me 1 second. I believe Dr. Clenchey is coming in February 9th to go over things. And I'm assuming that at that point they will, request a waiver again, formally. We may have some school committee members in the audience. I haven't looked, but they can surely give some input on this. But Dan, go ahead, say what you were.
So I wasn't trying to say yes or no. I really was, one, trying to make sure that we understand what the motion was, what your proposal was, because we haven't seen it in writing and you went very, very quickly. I just want to make sure that we understand exactly what's being put forward. I agree we're in a different place. I just want to make sure that we know where we are and what things we're talking about. So again, not saying in favor or against. For example, we talked about pool testing was part of the requirement to participate. I don't think I caught you saying that, but you may have. You went relatively quickly. So I just want to make sure that our criteria, that we're not in our brains thinking the criteria we worked on a few weeks ago and the criteria we're talking about now are slightly different. So I just that was my first question, was just, can we just make sure that we're clear of what the waiver of regulation is actually saying? The other piece was, certainly the last one we talked about was the 3-week trial. It sounds like this would be open-ended. If I think that's the case. I would again kind of bring us back to where we were before, of having, kind of a relief valve of a whether it's a recommendation or a hard stop of, if we have 20 cases in a school building, or 10 or 5 or whatever number we think is appropriate for the size of the population in that building, having that emergency relief valve. So it's not a matter of school committee coming back together and making a decision, or leaving it on the shoulders of the school nurses or the principal or the superintendent, that we're all kind of in the same place, same boat, of having that emergency relief valve until the school committee and the board of health individually or together can come back together and reassess where we are. Going, okay, you know what? Yep, it's a blip. We can continue, or it's more than a blip, and we're gonna go back to some other more mitigation strategies until that blip resolves. I just want to make sure we're all clear and on the same page, because if it goes forward, I of course want it to be successful. I want our students to be able to be unmasked if it's safe to do so. I also, it's hard enough being in masks. It's worse. You're in, you're out. You're in, you're out on a relatively short, rapid cycle. It's one thing. 6 months from now, something changes. We're back in it. That may be different. I don't want it to be, well, okay, we're off for a week. We're back on for a week. We're off for a week. We're back on for a week. That's not going to be, that's more challenging to everybody involved than simply make a good choice, put a system in place that can be successful, and have it be able to carry through. So that would be my kind of big piece. I just want to make sure that we can put this together so that protect them the best we can, give them the most options we can, and make sure we're getting feedback, certainly with this waiver. So, certainly if we put this forward tonight, certainly, theoretically the superintendent, the school committee, it depends on who we grant the authority to or how the school committee chooses the authority. Is it on the decision of the superintendent, the principal of the building, the school committee, or some combination of the three? Could theoretically flip the switch tomorrow. Again, not saying good or bad, but I just want to make sure that we're clear that the school administration folks can say, okay, this is thank you very much. We have it. Here's how our ramp up for implementation, and here's going to be our start date. So that I admit my high school doesn't go going, oh, apparently we don't have to wear masks anymore. And that's the first thing we hear about it. Considering we want to make sure we're all on the same page and we're all aware of what's happening in our community. So I know that's lots of little pieces. I just want to make sure that we can just spell it out. Our if there is a waiver, we put it out there. Kevin said that Superintendent Clenchey was looking to come back on the 9th meeting and formally request it. So I guess that I'm a little confused from a procedural piece of, certainly we can amend our regulation. I guess that would be my question. Would this be really truly amending our regulation, or would this be granting a waiver to the existing regulation for the high school building? So I think those could be two different things. If we are amending our regulation, that might, and again, we don't have any of our professional administrative staff, and nothing against you, Janet. I'm just thinking from a legal side of things. If we're amending the regulation, would that have to be posted as a what we're amending how it's worded, and then be posted to the newspaper before it comes into place, as opposed to a waiver regulation, which would require a request, I believe, but then it's in place as soon as we say it's in place. Just from a procedural piece, I want to make sure this is above board and no one has any questions or challenges, either from a amend the regulation and the posting requirement and the agenda requirement, or a waiver which doesn't have the posting piece, but really needs a request from someone, I believe. And I'm just not sure if Janet or we don't have.
Yeah, I think for the, I think a waiver would be sufficient. I don't think a entire amendment to the regulation is in order, just for a waiver for one building. I mean, after we get this off the ground and going and see that it's working, I think that's the point to where, we start talking about, amending regulations or doing away with them or taking next steps. But I believe there will be a formal request on February 9th by Dr. Clenchy, but I'm all but certain that this is something that they'd like to get in place and know they have the ability to do, so they can ramp up their efforts and get things in place for a successful operation. Mike, did you have a time frame, 3-week period in mind, or are you thinking this is open-ended? I know that when we last left Dr. Clenchy, his comment was sort of 10 cases a week would be the cutoff. Thoughts from the board on that as well?
Yeah, I just want to clarify. I'm not proposing that we take a vote tonight and the whole thing is basically rolling. I'm trying to open the discussion period. Okay. And to give you some idea of what the shape of that would look like. The answer to the question is this, that I view this as an effort to establish a protocol that could be used for other school buildings. And the issue of how long it would take for us to be satisfied requires, quote, time. I mean, even if everything were just smooth, a certain amount of time. As someone who is, used to observing, shall we say, things that are best treated with Bayesian mathematics that is somewhat chaotic. I do know that the school is coming up to a vacation period, correct? I mean, I know there's folks on this board who have kids in school. You're looking at a vacation period coming.
A few weeks, yeah.
Yeah, it's coming up soon, correct?
February 19th.
Okay, so the idea would be, this is me, not the board. This is me. I'd like to see this started. I would like to see this started before the vacation, so that we can understand very clearly how people behave and what they do when they go on vacation and leave the bubble of the school for more than 24 hours. Because the real world does consist of, we're in school, then we're out of school. That's the real world. And if it makes sense, it's going to make, this is one of the first opportunities we've had in, I don't know how many months or years or whatever, I lost track of it. Dan, this is why I'm, as it were, trying to get us started on this in our discussion. So this is one of the first times we've had a chance to do it with all the tools in place. I mean, I've looked at the B2 variant that's floating in Denmark, and I'm sure it's going to come here. It's this, I don't know what to call it. It's the offspring of our current version of OMI. And it looks like OMI, except it's a little bit more evasive of our immune system so far, but it's early. It hasn't gotten, it's taken, there are cases already in the United States, but not, as far as I know. There may be 1 or 2 cases in Massachusetts, but we don't have the resources yet to identify. So to make a long story short, I'd like to get it, it's my own view is like to get it started as soon as possible. And this may require more meetings than what we're used to having. I think we have to go back maybe to a previous scheduled, and also engage with the school committee and make sure that the school administration and their crack staff, which has done an incredible job, have a chance to input. and shall we say, make the necessary course corrections. You can look at this as our approach to Lagrange 2 position 1 million miles from Earth for the telescope. This is our version of it.
All right. So if there's no other board member comment, do any other members have a comment right now? Matt, go ahead.
One thing I was going to bring up has to do with the up-to-date, and I know that the schools were operating under the guidance that once their school populations were at 80%, they should consider a trial such as this. Now that we're many months past that original language was created, should we recommend to the school, should they be at 80% up to date? And based upon the boosted numbers that we have, I don't think they're there, but I think Katrina dropped off and I was going to try to, randomly ask her that question. But I would like to know that information to see how they feel, because if we're saying that boosted is the most important level of immunity, are they there?
Yeah, I think up to date's important. We do have a couple hands raised, of which one is a school committee member and Katrina, so they can probably answer those questions for us. Mike, did you have something to say before we take public?
No, I just want to say that the information about who is vaccinated or not is basically available from the state. So in other words, those data are available, and the administration through the superintendent's office can get that information very easily and quickly. They'd have it. They know.
So Mike, I'm not seeing it, because the data from the state is saying boosted per capita, which is not eligible to be boosted. It's a different denominator. So that's what I thought. If the school has it, great. That's what I would want to hear.
They can look it up in their system.
Yep.
Janet, do you want to start the public input session on this part of the night?
Do you have a preference on order? Did you want to hear from Katrina? Okay.
Whoever
Then Greg Panini.
We want to. Is the school committee members here?
There are a few. Yeah.
Hi. Yeah. Can you guys hear me?
Yes.
Okay. Sorry. Yeah. I'm not a member of the school committee. I just wanted to chime in on this. So I appreciate all the information you guys gave us. And obviously, it's very clear that COVID is still with us and we're still being affected by it. I just kind of want to go off of what Mike started talking about, which is the mask mandate with the schools. I've got elementary students in the school. I feel like at this point, I don't really know how we can argue that masks are doing anything to stop the spread of COVID. Everybody around us all has it, whether they've got masks on or not. And I don't understand. I mean, we all just witnessed our kids go through the disease. For all of them, it was a cold or maybe a flu. I don't really understand the argument that masking a child to protect the old and the vulnerable who are already wearing masks and are already vaccinated, that makes no sense. There's no logic behind that. So and also with the vaccine, I understand, okay, if they're vaccinated, no masks, if they're unvaccinated, masks. But if the child already got the disease, he does have antibodies for the disease. So he doesn't need to be vaccinated. He got the antibodies for the disease. I know there's arguments that, natural immunity doesn't last as long. We don't know that. It varies to person, whether they're vaccinated or whether they have natural immunity. It varies from person to person. So there's no way to say that the vaccinated kid is safer than the kid who just got Omicron. There's no way to tell that. And also with masks, if I can take my family to a town next door in Chelmsford or over in Marlborough or up into New Hampshire and go into any building without a mask, how is masking Littleton going to stop the spread? If the kids come home from school and they gather with friends and family and they're not wearing masks, and on the weekends, how is masking kids in school going to stop the spread? So, I mean, it's a facade with the sole purpose of pretending like we're doing something to stop a virus that's unstoppable. And so I would prefer to see these mask mandates lifted, especially for the children in school, as soon as possible. We know that it's detrimental to their learning. We know that it's detrimental to their social skills and learning, especially the young kids. They learn how to mimic facial expressions. They learn through speech by watching the lips, reading lips. So it's time to move on. The masks aren't doing anything. They didn't do anything last year. They're not doing anything this year. That's
Thanks,
all.
Greg.
Thanks.
Justin McCarthy.
Hey guys, can you hear me?
Yep.
Sorry, I'm just relocating to run away from my family so you guys don't hear them in the background. So Justin McCarthy, 7 Stony Stream. I'm calling in as a resident. I'm calling in as a parent. I obviously I'm a school committee member, but not in the presence of my school committee. I'm not acting on behalf of the school committee, and I think everyone on this panel understands that. I want to thank Mr. Panini for calling in. I echo all of the statements that were just made. I want to thank Mr. Zeldin for getting the conversation going this evening. I think this is what I was asking of you folks the last couple of meetings that you've had, is to have an open and honest conversation about the mask mandate in Littleton and how effective is it really. I sent you folks an email, I believe. I think it went to everyone. So of the 54 towns in Middlesex County, 30 don't have a mask mandate. Half of the 30 have less cases than us per 100,000, and the other half have more cases than us per 100,000. So I think there can be a pretty clear argument that cloth masks, surgical masks, aren't doing much, if anything, to stop the spread. If you want to protect yourself, you can become vaccinated, you can get boosted, you can limit your exposure, you can wear an N95 mask. Asking folks in town to wear cloth masks around is, I use this term not lightly because it has a negative connotation, but it truly is COVID theater. Just like the previous caller, we're pretending to do something. And really, the only folks that you're hurting, and this is where I come at you as a parent, is the K-12 population. Because unfortunately, you've made a rule and they have to follow it. And the other residents don't have to. They can leave town and go shopping elsewhere. They can go to Tavern in the Square and have dinner and drinks and socialize with hundreds of unmasked individuals. So the K-12 population in town are the ones that are suffering the most. And if those folks want to wear a mask, they can wear two. Many children will eventually not want to wear a mask, and there will be a return to normalcy. I know just one more thing. There was recently an article in the Boston Globe about a child who was afraid to go to school. She didn't want to go into school too early because she had to congregate with other students in the cafeteria. She didn't want to go into school too late because the hallways were crowded. Unfortunately, this individual thinks school is unsafe. And the data that Katrina just showed you, a K-12 student that's boosted they're the safest people on the planet. They should know that school is a safe place. And unfortunately, by requiring them to wear masks, there's this misconception, this delusion that it's not safe for them. And that's sad. And I see Jim shaking his head. Thank you. We need to get to the other side of this, and we need your help. And I would ask that you move forward tonight with a waiver for the K-12 school system. And I ask you as a parent, just move forward with a waiver, K-12. We'll take this one step at a time. I'm sure the school committee would be happy to have a joint meeting, but the kids deserve it now, not February 9th, after February vacation. We know how this goes. It lasts too long. So you're having a meeting tonight. Let's take care of business tonight. Thank you very much for your time.
Thanks.
Katrina?
Hi, I'm going to speak as a parent right now. So Katrina Wilcox Happer, 156 Hartwell Ave. I just want to come back to the idea of this mask flex program, trial, whatever happens from this point on in the schools in consideration to requiring boosters for this age group specifically. it sounds crazy. I just advocated for boosters. I advocated for vaccinations. I'm still advocating for vaccinations for everyone, but I would, the kids who are vaccinated are at such low risk of the really severe diseases and everything. So to add another booster requirement for them seems out of line with the data, in my opinion. And we won't get there. We won't get to a point where they're 80% boosted because there's just not that many kids who are eligible yet to be boosted. So I think that's too much, in my opinion, to ask the schools to do when DESE requires fully vaccinated, which is the 2-dose of a Pfizer vaccine for this age group. And the quarantine guidelines don't change for schools as well for any of those policies from what Jim mentioned earlier. So I want every individual to be fully vaccinated to the best that they can, including these high school students and middle school students who are now eligible. I completely advocate for that. I will bring clinics to town till the cows come home to make that happen. But I don't think this should be a requirement for the Mass Flex program. Thank you.
Thank you.
Some are for it, some are
Is
against.
Jennifer Klein.
Yeah, hi, I'm Jennifer Klein. I live at 2 Dogwood Road. I have a preschooler, and my husband had called in back in September because I think at that time, DESE had said that the preschoolers didn't need to wear masks at that age. And obviously they're unvaccinated. At the time we went to you and asked, if what the call was, and you had deferred it to the school district. And at the time, the school committee decided to mask the preschoolers like the rest of the Shaker Lane Elementary School, which was actually against DESE guideline. And I'd like to just read the World Health Organization guidelines for children under 5 years old. Children aged 5 and under should not be required to wear masks. This is based on the safety and overall interest of the child and the capacity to appropriately use the mask with minimal assistance. So I'm very concerned that the World Health Organization recommends not wearing masks for this age. My son has been in school now since September wearing a mask for 6 hours of the day. And there's a lot of learning that goes on with facial expressions, especially for an integrated preschool. And I understand that I would be requesting that unvaccinated children not be required to wear masks, which is not something we're discussing. And I think it's an important discussion because once you start saying that we have different rules for different people, unequal society. Excuse me, can you hear me?
Yes.
Okay, sorry, so I'm very concerned about having different rules for different people in the school district.
Well, the Department of Elementary and Secondary Education would set those rules and those guidelines.
Yeah, I'm still concerned about it, even if it's not something that you would decide. I don't.
We hear
I
you.
feel like it's un-American. Yeah,
Okay.
Great.
Thank you.
Kathy Olson.
Hi, this is Kathy Olson. I'm at 25 Whitetail Way. I'm calling tonight because I would like the Board of Health to get a date to move forward with the mask flexibility program. I agree with we are at and past our 80%. We're not going to get there if we keep pushing the date. Our parents have done their due diligence. We've gotten we've gotten our kids vaccinated, boosted if possible, not boosted if they've had Omicron. And I just don't understand what is the holdup with the Board of Health. I agree with the other caller where as an adult, we can go places and do things and take our masks off, but these kids can't do that. And there's a lot of there's a lot of missed education with these kids not being able to see facial expressions. And I'm not talking about just the high school. We're going to see this like 2-3 years down the road. What a disservice we've all done to our kids. And I would like to see the Board of Health put a date on the calendar to move forward for the mask flexibility program. I feel like school committee has been doing everything that they have possibly can to get us to this place. And now we're at the Board of Health's hands. And I feel like you're just stalling and you're just kicking the can.
Thanks.
Yep.
John?
It's John Kurzwick, 171 Hartwell. Yeah, I just want to echo much of what's been said already. Maybe not rehash what other folks have said, but just add a couple other points. So we've known for a while that the masks are really not effective. In May 2020, the CDC published a report. It was a meta-analysis. They looked at all the literature from 1946 to 2018. They found 10 randomized controlled trials assessing the effectiveness of masks. And this is what they said. In the pooled analysis, we found no significant reduction in influenza transmission with the use of face masks. This data has been around for a while, folks. We've known this for a while. And now all our observations are confirming what was said in May 2020 by our own CDC. So let's get the mask off the kids, regardless of whether they're boosted, vaccinated, or not. It's not providing any value, and it is causing a lot of deleterious effects. So I would go one step further and just say, it's time to take the mask off. I think we just heard, was there a town in Cohasset or something like that, that they got rid of the mask mandates, I think, or something like that, right? So I'm in favor of getting the mask mandates off for not just the kids, but everybody in town as well. So that's just my 2 cents. And I guess the last other point I wanted to make is the CDC just came out with a report as well, talking about natural immunity. And they compared that to vaccinated individuals. And they found over the most recent wave with Omicron that people with prior infection were at less risk of reinfection compared to those who were vaccinated. So I think we also have to take into account that there's a number of people who got the 2 doses and then they got infected, and those folks aren't going to go out and get boosted. They're protected. So we have to start taking into account that there are a number of ways that people can protect themselves. And I think when we start doing these top-down things, we start losing sight of, the detailed nuances of people's personal health. So again, I just hope that we can move forward and, get rid of these masks.
Thank you.
Thank you.
Cindy Napoli?
Good evening, Cindy Napoli, 47 Springfield Drive. I'm speaking to you as a resident, not as a member of the select board. I want to thank the Board of Health for bringing forward the discussion about the Max Flex program this evening. I want to commend all of the callers that have spoken up to this point, spot on points that they've raised about the mask mandate, especially the impact it has had on the student population. And so I appreciate people coming forward and offering their opinions. My kids are no longer in school. They're young adults now, but I cannot imagine what the children are going through and being a parent of children living through this pandemic. I know that mental health, development delays, and long-term consequences of masking on children, I believe has not been given enough weight by the Board of Health up to this point. And I hope that they will, that your group will take into consideration the comments that were presented to you tonight. The Director of Elder and Human Services, the Council on Aging, gave an excellent presentation last night at the joint meeting with the Select Board and FinCom. And she gave an overview of her department. And one of the slides, I actually asked her to share with me because I wanted to share it with your board tonight, but she didn't send it to me in time, talked about the rise in mental health issues that she has seen in her department over the past 2 years, specific to Littleton residents of all ages. And that has to do a lot with COVID and the disease itself, the pandemic itself, but a lot of it too can be contributed to the isolation that comes from wearing a mask. And as many callers have already stated on this call, we know that the masking, it's not working. It doesn't work. And so I hope that the board will continue to move forward with what it's discussed tonight, and also strongly consider at this point removing the mask mandate from the community overall, because as has been pointed out tonight, it's really not being effective. And I think we have lost sight of the emotional and mental consequences of wearing a mask. Thank you.
Thank you. All right, we'll take 2 more and then we'll finish our conversation. Hopefully have a motion and get something done.
Jen Gold.
Hi, Jen Gold, 259 Harwood Ave. I am a school committee member, but I'm calling tonight as a parent and a resident. I want to echo some of the statements we've heard earlier, and I also want to say that when the Board of Health, respectfully, when the Board of Health put a townwide mask mandate in place, I think it was in September, there were contingencies on that. And I think it was an 80 or 85% threshold of vaccination. We've hit that threshold and we still have a townwide mask mandate. And there hasn't been much talk about that. We also are, we have 2 schools now that have a threshold of 80% vaccination, which the Department of Education has said, should be eligible for a mask optional policy. And so it's frustrating because, as many of the other callers have said, the goalposts have kept on moving over time. What are we waiting for? We are a highly vaccinated population. We've complied with all of the recommendations. We've taken the mitigation steps, and this virus is going to be with us. We are living with it. And I just think that we need to move forward into the new reality, which is living with COVID sooner than later. Let the kids who are vaccinated, who have done all the right things, be mask optional if they're comfortable, and move on. So thank you for your time.
Thank you.
And Matthew Ridge.
Thank you. Can you guys hear me just fine or no?
Yes.
Okay, great. I appreciate what you guys have been have said mostly. I do hope that this does go a little further to the point, as some people have stated, that it goes to town-wide, and not just including with schools and everything else, because my son actually came to me today and said, when are we getting rid of these masks? He's like, I really wish COVID was not here. Well, we know that's not going to happen. But it's when my son, who is 5 years old, realizes that these masks are becoming a problem, because he has allergies. Everybody thinks he has COVID. He just got over COVID. And my wife got over it. I got over it. This is my second round with it. I got it when it first came around. I got it again now. We need to just live with it, as other people have said. We can't live in fear. We need to just move forward with this. I know that some people are going to be having issues where they have immunocompromisation and stuff like that, but we need to treat this exactly like the flu. Those people who are immunocompromised, if you want to feel like a mask is going to help you, wear a mask. Those who don't or who are not, please, if you're going to see people who are immunocompromised, wear a mask. If you don't, live life. Don't wear a mask. This is basic common sense. We need to start living our lives. We can't live in fear, and I'm afraid to say, but the mask right now is a Linus blanket. It is literally not doing anything except for allowing those few people to actually feel secure. Because the science has shown it. We have people who are double vaccinated, triple vaccinated. We have people wearing double masks, triple masks, and God knows what else. And we are still seeing people getting COVID. We're not going to get around it. It's going to hit us one way or the other. Even those who, like me, work from home, I got it. I don't go out. I go out only when I need to. I still got it. So it's going to happen. We just have to, and this Omicron is so weak right now, it's basically like a very mild flu, if you even want to call that. But again, I really hope you guys do take away the mandates, because right now it just doesn't do anything anymore. It's not protecting us. It's not helping us. And it's, like I said, when our kids are coming up to us saying, when can I take the mask off? We're done, because it's hitting everybody. And personally, I agree. We need to make it so that it's optional and that it's not mandatory anymore.
All right. Thank you, Matt. Did we lose Mike? Still there?
You mean me?
Yeah.
Okay, I've been here.
I know. I just didn't see your video.
I'm so well. You wouldn't say that about Tom Cruise. I don't know why it's him.
So, do you want to reverbalize your motion?
It's not a motion. I'm basically. I mean, I think the folks, including Dan, who mentioned it, I think I was trying to get the discussion focused on the high school tonight, so that we could lay the basis for February 9. And I understand a lot of the folks who came in are interested in the town-wide mask and have sort of conflated them. That's their right and their privilege. However, we're still dealing with the reality that of trying to make some movement in a place where there already exists a series of protocols, practices, and proven track record of being able to, as it were, mitigate COVID quite successfully. Which, by the way, I just want to say parenthetically includes masks, as well as ventilation and everything else. So my interest here was strictly to get things going with the high school building, period.
Well, in the essence of time, I'll make the motion.
Go ahead.
To grant the mask waiver for the high school, starting immediately at Dr. Clenchey and the school committee's discretion, with all the criteria that we set out the first time around.
Can I, a point of order?
Sure.
A point of order, Mr. Chair. Can we grant a waiver without a request for a waiver? I guess I'm just, from a procedural perspective, it just seems odd granting a waiver when a waiver has never been requested. I'm not saying that I'm against the waiver, but I just want to make sure that we are following some level of procedural process. I'm just not sure if this is the time to make motion from a procedural perspective. I do know the school committee is meeting last night. I know at the last school committee meeting, there was a discussion among the members. And again, I'm not trying to put words in anybody's mouth, but it sounds like at that point, they decided they were going to review where they were at their tomorrow night's meeting and decide what action they want to take regarding requesting a waiver. So I agree. I think we're all on the same parallel path. I just want to make sure that our procedures are appropriate and both meeting the goal and meeting the procedural piece. May I make a suggestion, if I can?
Please.
Perhaps I certainly know we still have a number of school committee members in the audience. They're meeting tomorrow night, I believe. If either the superintendent on their behalf or the school committee on their behalf makes a formal request for a waiver, perhaps not an emergency meeting, but we have certainly time to post a meeting for next Wednesday night if the board members are available. That's the week and a half before vacation would start. That if the school chose to move more quickly, they could start putting their things in place with an anticipation of a formal request for a waiver, a posted discussion for that waiver request, so that any community members who would like to weigh in and were aware that that was on the table could speak to next Wednesday. And now we have a procedurally appropriate waiver for a regulation request, a motion if it happens, and a vote if it happens for that waiver request to move forward and be in place following traditional procedure, and still have time for the school committee, if they choose to move forward in the school department, if they theoretically wanted to, could move ahead prior to February vacation. I will admit I'm concerned a few of the words of kicking it down the can that at our previous meeting, I forget the date now, I apologize, January 12th, a waiver was granted for the 3-week trial period. And it was actually the school committee and the superintendent's office who requested it to be postponed until further notice. So it wasn't the Board of Health putting the brakes on it. This was a request from the school committee and the superintendent's office. So I don't think we're trying to be in the way. We just want to make sure we're safe, and I think we want to make sure procedurally we're doing it appropriately.
Mhm.
As opposed to being an order, this is a regulation. So the process is slightly different than a policy or a procedure or even an order. Because it's a regulation, the process is slightly different perhaps than a policy decision perhaps from another board. So I'm not sure if that perhaps either a formal message from the chair to the chair of the school committee, or certainly the members who are here may want to pass it on, but we can still expedite this, but just follow procedure, or follow what I believe is the perfect procedure for a waiver of regulation request. Does that make sense to the board? Anybody else?
Matt wanted to say something.
No, thank you, Dan. That's exactly what I was getting at. Right now, we don't actually have a request from the superintendent. So I would much rather hear that directly and then say, yes, let's talk about it.
Yeah, this whole topic, Mike got us started on it tonight. I don't think any of the school committee members or the superintendent knew, this was going to be here. I'm sure if they were all here together and could take a vote on it, they would be requesting the waiver right now. Justin has his hand up. We'll take Justin's comment only.
Justin?
Yep. Hi, Justin McCarthy, 7 Stony Stream. Again, I come to you as a resident, but I have pretty good knowledge of what's happened. So the school department requested a waiver. It was granted 5-0 by you folks, that you were going to revisit it at your last meeting, at which point in time we let you know that the school department reached out and said, look, we're not going to start. We didn't ask you to take the waiver away. You guys then voted 5-0 to take the waiver away. So if your board is in favor of putting a waiver back in place, I would encourage you to do that, just so we don't have to wait for additional meetings, special meetings, or joint meetings. But if you don't, then don't. But I mean, honestly, make up your mind. We asked for a waiver, you gave it to us, you took it away.
Well, I think the question right now, Justin, is just a procedural one, and we're trying to figure out. I mean, maybe we can make the motion to grant this waiver, barring any procedural complaints by any entity.
That will be fine. I just simply don't think you have to wait for, the delay tactics seem to be.
Yeah, there's no tactic. We just want to do things by the book. That's all. Thanks.
I just want to make sure, frankly, that that the folks working with Dr. Clenchey and others in the system, on which the success of this depends, are also prepared to move forward with the understanding of the recommendations and everything else, that the small items that go with it. And the other problem, very frankly, is we could just vote to invite them to submit the request, and include in that request what they see as the operational details having to do with how they would, as it were, execute the program of testing flex.
Yeah, I mean, I think they know exactly what they're doing. I think they know how to do it. And I think, it's probably best to let them do their jobs as they've been doing over the past.
Yeah. I don't want to sit here fooling all the levers. I'm more interested in just getting it started. I just want to make sure that they're confident that they have, everything that they feel that they need in place to do this.
Mm-hmm.
So it could very well, if you feel that we could, procedurally wait until after their meeting, we could post a meeting, I believe. Is that correct, Janet? We could post a meeting.
We could post another meeting within 2 days. But Justin's right. We were the board that rescinded the waiver.
Right.
So
we did.
I don't think there's an issue on rescinding.
Okay, so you feel it's okay for us procedurally to put the waiver back in, to basically grant the waiver, period.
I believe so, and I'm comfortable with that.
And then leave the details to them, all the parameters, including the recommendation for the masks, to them.
I'm comfortable with that.
Okay. Maybe that's what we should be going to next. I don't know what Dan or Matt and what Gino feel about this.
Any board member comment? Gino, we can't hear you.
Cut me off all the time.
There you go.
Why don't you have the meeting with the superintendent, then the school committee, and this will go from there.
Well, in the essence of making progress, I'm going to make the motion to unrescind the waiver that was granted previously. I don't know if there's a second.
Excuse me, Mr. Chairman.
Yeah.
Okay. I believe, and maybe Dan can correct me with this, I believe it's the state that made the rules regarding the waiver and said that they could grant
No, this
the
is
waiver.
a waiver. This is a waiver for our mask mandate. That's correct.
Okay. That I think the wording for that would be a variance, just like we have a variance for other more mundane operations. All right. This would be a variant.
Okay.
A variance granted to the mask mandate that affects the school.
Right. So,
Okay.
So
it's a variance. In other words, we will say we're granting them a variance to exercise the waiver that they that they have a right to get from the state. Is that your understanding, Dan?
They, to the best of my knowledge, they've already received permission from DESI to utilize the mask flexibility option under DESI rules.
Okay.
They're currently masked based on the Board of Health regulation for townwide masking.
Yep.
The waiver that was granted, date specific, January 18 to February 4, I believe.
Excuse me. You just call it a waiver. You mean
Sorry,
it's,
a variance.
Yeah, I don't mean to be picky, but at least it distinguishes it from the state. Okay.
Right. No, it's a waiver of regulation. Our regulation. It was a waiver of applicability of our regulation in this setting, in this situation. Variance waiver. Okay, so we can use variance. So we granted a variance to the Littleton Public Schools high school building for mask flexibility from our town mask regulation with a time specific window of January 18 to February 4 for a trial with the pressure reliefs and everything that we had discussed and criteria for inclusion. The school department on January 7th sent out a letter to all high school students and parents that it was postponed until further notice. The Board of Health was notified on January 10th by Superintendent Clenchey that was in fact the case. We are suspending, we're not going to move forward with this. It's on hold until further notice. At our January 12th meeting, after it had been granted, it was a time-specific variance. It had dates associated with it as a variance to a town regulation, which is basically has the applicability of town bylaw. That the characterization that we rescinded it, we really didn't. We cleared it off the books because it was no longer applicable. It had a applicable time window that was no longer applicable. So we simply cleared it off the books so that
you're right.
Just as a housekeeping measure.
Yep.
So we rescinded a waiver that really had no applicability anymore. So, and the following night, school committee had their meeting. They were advised of it. They continued, and sounded like, again, from my listening to their meeting, was that they were going to review it at their following meeting on tomorrow, 27th of January, to see what action to be taking, basically the same way we did. Let's see where we are. They knew where they were 2 weeks ago, just as we did. They wanted to see where we were in 2 weeks now, of what their action should be as a school committee and a school department. That was my impression of their meeting. And here we are today, and trying to figure out how do we best move forward.
It sounds like we're going to wait for them. Make a decision.
I'm not sure if we can unrescind, because the waiver the variance that was granted, if we
It was time specific.
unrescinded,
Right. Yeah.
we can't really. Wouldn't go back in place as it was unless it expires on February 4th. Could we theoretically modify that variance? I think we certainly could do that. However, I would have a procedural concern with doing that without having it during a publicly posted meeting with that topic. Same as if it was a septic system or a fill in a any other variance to town regulation would require a posting and notification. Now, in this case, it would be simply a posting. This is on our agenda. I would be concerned purely from a procedural piece with that, which is why I suggested that perhaps, a formal request simply as a procedural piece from them tomorrow night.
Yep.
We can post a meeting, for next week, and this could theoretically, this isn't postponing. This is simply following the rules that we need to follow. And it could theoretically be legally in place next Wednesday night at 7:05,
Right.
or however long it takes for the public meeting.
Yeah, we can
Theoretically,
actually,
the school could put that into place Thursday morning at 7:15 if that was their choice.
right.
So I don't think we're trying to postpone. I just want to make sure we're following procedure appropriately. And again, I would love to give time for everybody to be successful and have it in place. I think a lot of that footwork, as we've already talked about, has been done. We know what needs to be done. It's not, it's been figured out. It was the school choice of what puts us on hold. And I certainly agreed with that choice when we saw 300 cases of town, one of our reports. I think this is not delaying it. I think this is trying to follow a procedure.
No, I agree. I agree.
And we're willing to come back and have another meeting to make sure this is, we're not asking, I'm certainly not asking to wait till the 9th. I think, next week is perfectly appropriate. I don't think.
Yeah, you're right. You're right. I'd like to suggest we meet on Monday because we can post it tomorrow. We can get the request from the school committee and Dr. Clenchey, meet on Monday, and they can have it in place for February 1st. Get almost 3 full weeks in before February vacation.
Kevin, we would need to check with LCTV to make sure that there's staffing.
All right. We'll table that, but can we make that a goal?
Good goal.
All right. Any other comments on the mask mandate agenda item?
At the risk of prolonging our evening tonight, do we want to put on a subsequent meeting a review of the situation regarding the townwide mandate?
Yeah, I mean, I think we should take a good look at that. I mean, I was seriously consider bringing up the fact that, you know, it might be appropriate at this point to only require masks indoors at essential locations to protect the most vulnerable folks, grocery stores and pharmacies, and the like. And I think that, you know, with what we're seeing and the data we've heard and from Jim and Katrina, that, you know, at this time it's probably appropriate to do that.
I need to ask a question of Jim, and I hate to put him on the spot at whatever hour it is. My watch is now on. Oh, good grief. All right. Anyway, Jim, without the usual confidentiality here, are we seeing cases, the clusters in individual families and neighborhoods? And is there any reason to believe that there has been transmission and, shall we say, spread attributed to any of the, I'll call it, commercial or healthcare locations here in town? In other words, do we have an idea geographically, location-wise, with however defective or however complete the tracing is? Do we have an idea of where things really get going with these cases? The cases, I understand we're not hospitalization, cases.
Sure. So as you might imagine, particularly with something that's as transmissible as this, households still seem to be the largest source of clusters, if you will, you know, more than 2 cases at a single location. And I'm not sure that we have seen to document a cluster someplace else. So again, households seem to be the place where this is being transferred.
Okay. In your travels, as it were, and talking to other health agents, do other towns and cities see cases recently that either can be traced back to grocery stores, convenience stores, liquor stores, places where coffee is harvested? I mean, where people have coffee. In other words, is our particular profile of clusters in neighborhoods and in homes unique?
So I guess the only data I could tell you is when I pull the numbers for you, I kind of take a scan of each town as I'm pulling those numbers. And the same thing, you're looking at multiple names assuming they're the same households, and again, not seeing cases in retail stores or convenience stores, to the best of my ability to look at the data that we're getting.
In other words, when you do the back tracing, try to
Right.
see where things go. Okay. To me, we've just been handed a gold mine of information. And this is one of the things about this particular virus that is interesting. Let's put it that way. Anyway, so this is an interesting piece of information.
So are there any other comments regarding the mask mandate, or should we look to move to a meeting for hopefully early next week with a couple of specific line item agenda items? Matt?
I appreciate that we want to start moving forward in a more thoughtful manner, and I love that. I know it's hard on the community, especially to hear kick can down the road and moving our goalposts. I know we're all feeling it because we're all here together. And I would love to plant the seed now so that over the next few weeks, as we figure out a new plan or a better program, I don't want to throw darts and I don't want a Monday morning quarterback, right? Because neither of them are really the right way forward. I want to figure out how can we use science and how can we use data to be a little more methodical and logical and not have things with no end points. Because none of us like that. Nobody gets off these meetings as says, yay, we passed something that everybody hates. So I've thought about, can we put in a better system that helps inform us as well as helps inform our community? Something that's a dashboard that has more pertinent data points that says, hey, when all of these things turn green, we should strongly consider not having any remediation effects in place. When these things start to turn yellow and red, we should have remediation steps in place. Whether it's masks or not, I think that's a little harder because, as we've heard, science goes both directions on this, but we have to have some levers to pull when things start to look bad, and some levers to release when things start to look good. For me, one of them is always the bed utilization. It's not just about if COVID people are in the hospital, but they use up more resources. They apply much more pressure on our healthcare workers. And so I'm always worried about that number. When that number starts to look better, hey, I'm much more open to hearing about, okay, well, what are the next steps then? So as I said, nothing for right now, but please think about how we could build that over the next few weeks, something that we can all look at and lean on a little bit more, and then also make it more available to people so that we can all look at the curves and say, oh gosh, things are starting to look pretty good. Things will relax a little bit and plant some hope out there.
Yeah, I mean, 85%, between 85 and 93% of all hospital beds being utilized right now is not a good thing, and we don't want to add to that. And I understand having the metrics in place to be able to use to make some decisions. So I appreciate that. So I guess we'll take any other further. We have one hand up. We'll take one and then we'll move on.
Matthew Rich.
You sort of answered my 325 Great Road. You sort of already answered my question, but I hate to say this, you guys are kicking the can down again. This is
no, it's a procedural thing to deal with.
Okay,
yeah,
fine.
I've gotten my wrist slapped so many times, Matt. I can't do it.
Well, here's okay, because the thing is that if you say science goes both ways, that's fine, but can we start actually listening to the science? Because this is not one of these things. I mean, we've had people being told that we're not telling the truth, and it turns out that we were told that COVID is now, you're saying it's hospital. Now we have to look for the hospital beds. You know what? I'm tired of the goalpost moving again. No, I'm done. We need to stop this. We need to stop saying, okay, this looks green, this looks good, but guess what? We have more beds being used. It's flu season. The CDC themselves said that they couldn't tell the difference between the COVID and the flu in this last prior test. They came out with version 2 to just take care of that. That just came out. Nobody's using it yet. I'm just going to, no. Stop. I have the floor right now. Please let me just talk. This is one of these things I'm just getting annoyed at because I am tired of people saying we need more data. We've been demanding this for God knows how long. And now you guys are like, now that we see a light at the end of the tunnel, we're going to extend that tunnel just a little bit further. I'm sorry. Enough's enough. I'm one of the loudest people that you will ever hear on the school board saying we need to stop mask mandates. And right now, everybody's saying that the hospitals are being used. Yeah, they're being used because people are panicking and people are being told, go to the hospital to get the test done.
Yeah, and the hospital comment and the data is a totally separate issue from the school.
But exactly, that's the point. It's an entirely different situation. It's an entirely different thing. And Omicron right now is so infertile. It is so irrelevant when it comes to being hospitalized. The only people who are being hospitalized with COVID right now are people who have immunocompromisation from something else, who have a weakened immune system from something else, the flu, pneumonia, something else is causing them to be there. Just because they have it's with COVID, not because of COVID. We need to start using words correctly.
All right. Thank you, Matthew. It's just about 9 o'clock. We have to move on. We have another agenda item, but I appreciate your comments. All right. So 7:45, it was asked of us to go over the residential trash haulers regulations that we have, and Jim had sent that out to all of us. Jim, is this basically verbatim what was discussed in 2011?
So that's, and I think I had mentioned in my email to you that I need to go back and to those minutes and see what was actually done and how it was actually done to get a sense of that. But I that was a different board. That was 10 years ago. I guess in fairness to you all, it'd be good to be able to take a look at those. If they were enacted, whether you wanted to make some changes to it. One thing I noticed, just kind of a clarification on the recycling part of it. I think the regs talk about, this is on 5.3, haulers shall provide recycling as part of municipal. It probably should be in accordance with whatever the Massachusetts regulation is, because I know there's some waste bans out there, and I'm not sure it happens as much anymore, but sometimes a competitive edge is in place if somebody's not offering recycling to the same extent that it's required. And so making sure that's clear would be important.
Does anyone else have comments on these regs? Dan?
All right, quick question. So it's, I did not see the discussion that led up to this being on the agenda tonight. If there was an issue, if this is simply a 10-year regular review of regulation, or
It was
a prompt to this?
Yeah, sorry. It was the chairman of the select board had been in talks with a few different citizens who were unhappy with their solid waste service. I think mainly because of the consolidation that Harvey just bought a bunch of them. So he was asking if we had a list of preferred vendors, and that triggered Jim to say, oh, wait, we need to talk about these regs. And I think once we get these regs together, we can come up with a list of vendors that have sort of actually been licensed in Littleton that we can put our, put on our website, and folks can go to them for service.
So these are our current regs, though, correct?
I don't know if they've been adopted, and Jim doesn't.
I have to go back and take a look at the regs. So
we are not licensing solid waste.
Currently, you're not licensing.
So I know certainly from the state model regulations for boards of health, solid waste haulers are in the model regs. So I'm surprised that we didn't have it as part of ours, and we haven't been licensing in the past. So, okay.
Welcome. Yeah. So what will it take to, with a couple minor adjustments here, what will it take to get these regulations in place, public hearing and a vote?
I guess what I would suggest doing is putting it on the agenda for next meeting. I'll take a look in the meantime through the minutes, see where they're at. You can check. Like I said, I wasn't sure if any of the other members had any other comments. I just want to check on that recycling piece to see if that needs to be tightened up. And if it doesn't, if it's fine the way it is and they were enacted, they're in place, it's a matter of start licensing. We could send out, get a list of the haulers and send out licensing packets to them. One thing you will need to do is set a fee based on the regulations for the license.
And what were you suggesting we change in section 5.3?
Well, I just want to make sure that I know there's waste bans, so certain things you can't throw in, things that need to be recycled. I just want to make sure that language is tight enough so that haulers are doing what they need to do in accordance with state law.
Right. Okay.
It may be fine the way it is. It's just 10 years solid waste regulations and that have moved on to. So I want to make sure that's
okay. Any other board member comments on this?
Nope.
So Janet, can we just put this on our next agenda as a public hearing? We'll put maybe Jim, just let us know if that 5.3, if you think that needs to change.
Yep.
And we'll put this in the meeting packet. And regarding a fee, can that be discussed at our next public hearing, or do we need to include it?
I would include it in your public notice so that, it's clearly noted that you're going to review and revise as necessary and approve a fee.
Okay.
Kevin, by next meeting, you don't mean next Monday, you mean?
No, the February
our
9th
next
meeting. Yeah, because
official.
Kelly Clenchy probably won't have to attend on the 9th now, so we'll open up some space and then we'll.
Okay.
Okay. Awesome. Thanks for digging these up, Jim.
Yep.
How hard did you have to look?
Well, I just was going through, just folders to see where, my filing system's not the best, so trying to figure out where I put stuff and,
Yeah.
I'm trying to figure out the time frames too. That's sometimes the hardest part.
Gino, do you remember these?
I have to have this. It's a long time ago. We were using
2011. You were on the
Anyway.
board. All right. So moving on, any correspondence to be discussed? Yep. Go ahead, Dan. You're muted.
I am muted. Sorry about that. I did just take a quick peek. It looks like we have regulations posted on our town website under the town clerk's office, E360 regulatory piece. They do not seem to match on my first quick skim here as we're in the middle of our meeting. Are the paper copy or the electronic copy that was sent out, it does not appear to, but we do in fact have licensure requirements renewed each year. So we do have these, at least according to the town clerk's office, on the books as regulation. We have solid waste
But
regulation.
they differ from
Adopted by the Board of Health of the Town of Littleton, 9/3/2013 amendments noted where applicable. So
Yeah, a long time ago.
So it is old, but this was after that date is 2 years after the date of the versions we've seen in our email today. And I mean, my really super quick glance at it, it looks relatively consistent. So it probably still could use a review, but we do in fact have solid waste and hauling requirements, including licensure requirements renewed each year on the books. So this is certainly a concern with application of existing town regulation around licensure and practice.
Does it say the fee on there?
It's fee for solid waste haulage to be determined by the Board of Health. See the Littleton Board of Health office or website for a fee schedule. With no link from here to that, so I would have to go search for our Board of Health fee schedule or the town clerk's, town treasurer's office fee schedule for licensure. But it does refer to a fee.
Well, yeah, let's put on our agenda for the 9th then to just review and adopt newer, updated hauler regulations and adopt a fee schedule for the Board of Health. Okay. Okay, so moving on to correspondence. Sorry, I know it's getting late. Is there anything pack it up there. Any correspondence stick out that you all would like to discuss? I'll open up the floor. I mean, I think we've go ahead, Dan.
Sorry, I know it's late. I had 2 quick questions for Jim since you're here. Some of our correspondence was our wastewater, our independent wastewater treatment plants around, for those out there in the world listening, that a number of our commercial facilities and some larger residential places have basically freestanding on-site wastewater management, basically big septic systems. So for Patriot, the report for Patriot Beverages came out, and I just had a quick question that it has some permit limits of how much stuff can go in the effluent. And it looked like, so for total nitrogen was 25 milligrams per liter. It looks like the effluent was 81.8. And I believe the last time it was over as well. I guess I'm curious, is that a concern that it's over their, basically their permit limits? And it sounds like I looked back quickly and I forget what the number was, but it looks like it might be a bit of a pattern. Is that something that we need to be worried about, should be looking at? Or is it? I don't know.
Sure. So the treatment system, I believe that's for their wastewater, for their processing waste. I believe, because I think their septic system is up on the, up close to the standard Oak Hill Road. I think it's up behind one of those buildings. And you're right, there has been a pattern of exceedances. And I think part of it is, as you discuss that with them and their operators, because I've had those discussions in the past, part of it is low flow coming through. Part of it is maybe design. Part of it may be the technology that they're using. I can certainly talk with them and see if they've had, I think they have an amphidrome system that's there. Talk with them and see if they've had somebody come out and take a look at it, because it was shut down for a while. Now it's been up and running for a while, so any issues should have been kind of worked out. But that's certainly something I can have them, I can ask them about and ask them about. There's one major contractor who does these amphidrome system, FR Mahoney, and I can ask them if they've had somebody out.
That'd be great. I mean, I'm just curious. Is certainly the limits were set. I'm sort of from DEP or from best engineering practices. Is this something that we need to be concerned with if it's a pattern of exceeding those limits?
Yeah. So there's and this isn't. This was approved. This is a technology approved under DEP's what they call provisional use approval. Nitrogen's a difficult thing to treat. Treatment plants like at the nursing home and down at the apartment complex, they do a little better at getting close to their standard. Plus, they have a lower standard. Sometimes, depending on the waste stream and depending on how much of it they have, it makes it a little bit more of a challenge. And the fact that they're provisional use approval kind of indicates that that's the case. I did press the state at one point when there was a pattern of exceedances, and they weren't really going to do much about the provisional use approval on that. So they suggested that if the board wanted to do something, that was entirely up to them. And again, I can talk to them about what's going on there as far as the process. It's a biological process that needs to have all the right conditions, including carbon sources and alkalinity and that, to make sure that it works properly. So.
Oh, awesome. Thank you, Jim. Sorry about that.
No problem.
Go ahead, Mike.
I just have one. One of the correspondents came in I'll call it from an anonymous source, employees of a facility in Littleton, and it it reads pretty much as a horror show, and it's I'm always suspicious of and concerned about anonymous submissions, and for obvious reasons. My question is are all the facilities, the public facilities, especially those, I'll call it personal services, are those also subject to inspection from Board of Health?
We don't issue a license to any of them, Mike, unless they have like a food service component or some other regulated part that we have license to regulate.
Okay, so personal services don't fit into any of our criteria, correct?
So there's a board of estheticians, there's a board of cosmetology. These are at state levels that issue licenses for people who do those jobs. I don't know what their criteria is for inspection.
Okay, so it's very possible that the personal services referred to in the anonymous letter do not require licensure by anybody.
Well, I think depending on what they are, the individual practitioners may require licenses.
Okay.
A barber, a hairdresser.
Okay. Yeah.
I saw I think I know which one you're talking about, and I was going to at least go up and provide education on what they should be doing with employees with regard to COVID and time off and quarantines. At least when the state of emergency lifted in June of last year, all of those workplace safety standards kind of lifted with them.
Yeah, I see.
There's not all of those things that govern anymore, but when we get a business complaint like that, we offer to kind of go through what they should and shouldn't be doing, and what's best practice.
Yeah, that's a great place to start the spread of something even more interesting than COVID. So I would suggest if you could make a visit, that would be good. Sure. Thank you very much.
Yep.
Do we need to do anything about the Cricket Lane and the obstructions in the road? I mean, that's obviously not our purview.
Although I'm not sure there's much we can do. I saw that, and I don't know it's the first time I've seen somebody kind of bring that up to, I think that's more of a civil and police matter.
Yep.
Yeah. Okay. And, just to circle back in regards to correspondence, the elephant in the room, we had the other anonymous complaint there. Do any board members have a comment on that or want to suggest anything moving forward? I was just going to say, yeah, go ahead, Dan.
I was just going to say, certainly for all of us that with the days of easy Title V's are on the sidelines for the moment, that these certainly do go long. And if someone needs, a reminder that, can we take a 5-minute recess is certainly an option. Those things are always okay. Again, that's the pleasure of the board and the chair, but I think it's perfectly reasonable that same way that we would step out to use the restroom if we were in person, that, asking for, a 5-minute recess if we need to reset the board or reset the issue or deal with tech or simply to get up and move around a little bit is perfectly fine and appropriate, I would say. As a member of the board, and I would hope that I'm sure the rest of the board would agree with that. And certainly if somebody needs to step out, we all have families that we are working with and taking care of, and we all recognize that sometimes things happen. If you need to step out of a meeting, as long as you still have quorum, that, I think we would all understand that as well, and just recognizing that's okay.
That's a great idea. All right. So moving on to any member updates, comments, anything for discussion?
I'd like to thank and appreciate Gino's comments. We understand, very clear, and our sympathy, condolences go to you and your family.
Thank you.
And they're very lucky to have you around.
We all
Thank
are.
you.
Yep.
Thank you, Kevin.
All right. Is there any public hands raised right now? All right. And I guess all that's left is a motion to adjourn.
I'll make a motion to adjourn the meeting.
I second.
All right. Roll call vote. Gino Fratelloni,
Yes, thank you.
Dan Kane,
Dan Kane, yes.
Matt Wason,
At Wason, yes.
and Mike Zeldin.
Mike Selden, yes.
All right. Kevin Baker.
Have a
votes
good
yes.
night.
Have a good night. Thank you, Jim.